This is a refresher training on the Child and Adolescent Needs and Strengths, CANS, and the Pediatric Symptom Checklist, or PSC-35. We are going to review the following points on how CANS and PSC-35 fit into our system of care, and also how to apply best practices to these measures. First, some background on how CANS and PSC-35 came to be. CANS and PSC-35 were implemented in October of 2018. Both measures are mandated by our State Department of Health Care Services, DHCS, as part of the Medicare Final Rule. CANS applies to clients aged 6 through 20, while PSC-35 applies to clients aged 3 through 18, including clients aged 18. Due to these age ranges, there is some overlap with select adult and older adult behavioral health (AOABH) programs. Clients within the appropriate age range are administered CANS and PSC-35 when applicable. Lastly, CANS requires certification to administer and is usually facilitated during the child-family team process, while the PSC-35 is a self-report measure given to a client's parent or caregiver. How does the CANS certification process work? Our CANS certification process is facilitated by the PRAID Foundation, our certification vendor and one of the developers of the CANS, via a training website. Certification lasts for 1 year and can be renewed. In order to access the training, coupon codes are used on the training website and are re-entered yearly to maintain access. CANS certification can be tricky to navigate, so here are some tips for obtaining certification. Many clinicians struggle with passing the test based on the last point, making assumptions. We are often good at inferring information from clients or making hypothetical guesses that turn out to be accurate. However, the CANS is explicitly designed to gather data on what is being presented, not on what we infer. When taking the certification test or administering the measure, keep the questions on the right in mind. CANS is good at organizing information in a way that helps everyone understand what is needed in treatment. Of particular note in this list is the 5th and 6th bullets. Is the need impacting the use functioning in a given area? If so, how urgently do we need to act? Framing CANS in this way can help operationalize the measure in treatment and develop buy-in from the client and family. Let's explore this facet in more detail. Both CANS and PSC-35 were selected by the state as data-driven measures. When presenting CANS to a client and their family, we can operationalize it similarly to how we introduce scaling in cognitive behavioral approaches. If a client and their family rates items as 0s or 1s despite evidence to the contrary, they may be in denial, desensitized, or uninterested in treatment. They may also have knowledge deficits, which we can help with in treatment. On the other hand, a client and family who rates items as a 3 despite evidence to the contrary may have a lot going on, but may also be catastrophizing. By helping clients organize their needs in a functional manner, CANS can help clients prioritize their needs and approach their treatment in a goal-oriented and logical fashion. PSC-35, on the other hand, is a little different. It is more straightforward in how it presents information. Either you hit the cutoff score, or you do not. Nonetheless, we can glean useful information from the PSC-35 and use that information to help inform the CANS. So far, we have talked a lot about the background of CANS and PSC-35 and how they fit in treatment, so let's focus on the data entry component. Much like billing and clinical documentation, CANS and PSC-35 are reviewed by the state and must be entered correctly. In order to get this information to the state, we upload them into AQIS via a power form. This is just a fancy term for the electronic version of the measures. Both CANS and PSC-35 have 5 types: the initial, reassessment, discharge, administrative close, and urgent. Updated definitions and guidelines for use are included on the CANS and PSC-35 FAQ and our administrative workflows. The process by which these forms are entered into IRIS is different between county and contracted agencies, but the resulting form is the same. When entering CANS and PSC-35 into IRIS, special consideration must be taken. We should be mindful of which fin is chosen to chart the measure, what performed on date is entered, what order you are entering the measures in, and whether your program or other programs completed CANS or PSC-35 previously. You can find this out by checking the client's chart in IRIS first. Though rhetorical, it is necessary to ask, does correct data entry matter? Yes. Good data entry practices notwithstanding, we have a few errors in the system that will need to be corrected. AQIS is working with IRIS IT to analyze and develop error correction strategies. Here are some examples of errors we are seeing in the system. Multiple CANs and PSC-35 of the same type entered, for example, multiple initial CANs or multiple discharge CANs with nothing in between. Forms being entered too early or too late. Forms entered in the wrong order. I have seen instances where a client has had a reassessment CANs entered and then the initial afterwards. Another example would be a discharge CANs being entered with no initial or reassessment in the chart. And lastly, forms being charted on the wrong fin. Now, to prevent these errors from happening, I want to highlight 2 important principles. First, coordination of care and communication within programs. Coordination of care has always been a challenge, but CANS and PSC-35 necessitate clear coordination. If coordination of care is not possible, say if a client drops out of care and is not closed right away, it is important to thoroughly check the client's chart before entering new CANS or PSC-35. This will help you avoid making additional data entry errors going forward. Second, I want to emphasize the importance of communication within your own program. No report, heads-up display, or workflow can replace the importance of good communication. Coordinate with your colleagues working on cases with you to ensure you are not duplicating work. Lastly, it is important to look in the client's chart first before acting. Both county and contracted programs can see all CANS and PSC-35 forms in a client's chart from all CYBH programs. If you look in the client's chart and are concerned you may make an error, do not be afraid to ask for support. Correct data entry is a team effort and can be achieved with practice and good communication. Now, you might be wondering, where can we see the CANS and PSC-35 forms entered in the chart? Can a county program see CANS and PSC-35 from other county programs? What about county programs seeing forms created by contract agencies? Yes, you can see CANS and PSC-35 from both county and contracted agencies in IRIS. Let's take a look at how to do so. For county programs, you can use Clinical Documents or Form Browser in IRIS. In Clinical Documents, you can adjust the date range using the arrows in the red box to change the starting date forwards or backwards. This will ensure you can see all of the CANS and PSC-35 forms completed. You can do the same in Form Browser and can choose to sort the forms differently in both. Let's look at Form Browser in a little more detail on the next slide. For contracted programs, you can use Form Browser to view CANS and PSC-35 from your own program, as well as from other county and contracted agencies, as discussed before. In Form Browser, adjust the date range using the arrows in the red box to change the starting date forwards or backwards, as discussed earlier. You can sort forms a variety of ways. I prefer Encounter-Date, as it shows the fin the form is on, the facility and encounter type of the fin, as well as the date. Then you can see the forms below. You can double-click on a form to view its contents in more detail. In order to help facilitate error corrections and to make it easier for programs to monitor their own CANS and PSC-35 data entry, IRIS reports are in development. Until these reports are made available for use, error reports will be distributed by the IRIS liaisons and data analytics team. As you receive these error reports, feel free to reach out for support. Here are some resources available to you for CANS and PSC-35. Our FAQ will continue to be updated periodically, and new resources will be made available, especially as the error correction process begins. You can download these resources at the CANS and PSC-35 support websites as shown. Thanks for taking the time to watch. Please reach out at the contacts above if you have any questions or concerns.